Lot of occupations are based on shift duties. Some people work entirely on night duty, someone entirely general duty timing, that is during the daytime, and some work on different shifts. In this video, I am going to talk on day and night duties. For example, armed forces of all over the world, because most of the wars happen in the night, so they do have shift duties like a night working for armed forces. In army also, we do have some days, some weeks, different units work on night shift duties because it is for the physiological adaptation. For example, hospital duties, nursing officers of army and other paramedical staff, they do work for a long period on night duties. I recall when I joined military, that time nursing officers night duties for almost 3 months. So they work continuously on nights only for 3 months. And after that they shift to the day duties. Now how long should you be on night duty? But there are a lot of companies, industries in around Hyderabad and all over the country, people are shifted every week. So what is the physiology of adaptation of sleep? Suppose this week I work completely, entirely day duty. Next week I work night duty. Then the buffering days, 2 days I will lose. Why? Because body cannot adapt immediately within 48 hours of changeover the time, because depriving sleep and starting a alert job in the night, this buffer zone is very terrific actually. That is the time people commit mistakes, people may land up in accidents, industrial injuries can happen, mistakes can happen. So that's why when you shift these duties, that buffer zone need to be in mind. Secondly, immediately within 4 or 5 days, again if you need to shift the duty, it is a disaster for that industry. Industrial heads and managers should understand human physiology. You cannot have a duty shift. At least 3 to 4 weeks is the minimum time for adaptation. I mean, you cannot shift a person immediately 2 days or 3 days from day duty to night duty to day duty. You must make that person work entirely in night duty at least for 3 weeks, 4 weeks, so that he get adapted to this night sleep. For example, Muslim community, they do roza for 40 days, isn't it? If you do only 2 days fasting, then your body will get disturbed. Sleep is a recharge mechanism for brain, so your brain faculties all get disturbed. So that's why, my dear industrial managers, owners, even occupational health specialists, health management, you must make sure that your employees don't change their duty shifts every 2 days or 3 days. That is a pathetic. Most ideal condition is 12 weeks. 12 weeks is the probation period for brain for any physiological adjustment. It's like a job's probation period. So a lot of people don't understand this. In fact, your companies, your organization, your outcome and productivity will go down if you keep shifting people on a rotatory job. Yes, you're required to produce in the night also. So that's why what you should do, at least 3 to 4 weeks you must keep this shift and then change to the day shift. So if buffering 1 or 2 days goes also, people will have effective productive period of at least 18-19 days. But ideal situation is 12 weeks. 3 months is a complete. A person can work throughout in the night like a day with a good productivity without getting any effect on the brain, and organization and employee both will benefit. 3 months is ideal long shift to work on night duties, and the lower limit is 3 weeks, 21 days to 1 more week. But every week shifting night duty, day duty, Every 3 days cycle of day duty, night duty, it's a disaster for the employee and employer. There is very little research data available, but I did search. But out of experience, traveling many countries, serving in armed forces, a lot of observations, this is what I feel. You may study and you may get more information on this. 3 weeks or 3 months, there's only two choices to plan your employees on shift duties, especially day and night shift. I'm not talking about 3 shifts of the day. I hope this is helpful to you. Take care.